I want to acknowledge the Permanent Secretary and the Principal Assistant Secretary in the Ministry of Telecommunications, Science and Technology, Ms. Joan Joseph and Ms. Pat Francis, and the other representatives here from the Ministry of Telecommunications. I'm always privileged to be in this institution. This is an institution with so many great people working 24 hours a day, delivering great services to Antiguans and Barbudans, visitors, residents, citizens alike. I think most people underestimate and perhaps underappreciate what goes on at a facility like the Mount St. John's Medical Center. And the team of doctors, nurses, X-ray technical people, admin people, management, orderlies, EMTs. This is a good example of what it takes to deliver, fairly advanced healthcare, even in challenging circumstances. And by challenges, I mean challenges both in terms of resources and challenges both in being able to respond optimally to the myriad of challenges and the myriad of conditions that the physicians and nurses and all the support team here respond to and address on a day-to-day basis. It should come as no surprise then to you that I have myself been the recipient of very great care in this institution. My son was in here recently in a very serious situation, and the team here was so spectacular. So there's always a soft spot in my heart for the healthcare institutions in this country, being a physician myself and a licensed physician. So today, very simply, I have been in communication with the CEO, Mr. Deschamps, from MSJMC, and I am aware of certain shortcomings, and they have requested that we try to assist in further expanding the IT platform here. And you may or may not be aware, but back in 2007, the Ministry of Telecommunications assisted Mount St. John's, and still does up to this day, by providing high-speed internet. This is valued at approximately $0.7 million per annum. We obviously don't get paid for that. This is reconciled with the Ministry of Finance, but up to this day, Mr. Deschamps, Mount St. John's gets high-speed internet from us. And I am saying to you as well today and your team that should it be necessary, we will provide additional bandwidth so that Mount St. John's and its employees can benefit. But there is a second dimension to this, and that second dimension is that many of the people that receive services here come on an outpatients basis, whether they are going to access the X-ray department services or the outpatient services department, et cetera, et cetera. And in keeping with the government's thrust to make this country technologically competitive and electronically savvy, we are today commissioning Wi-Fi hotspots outside the accident and emergency department, in the waiting room, outside the outpatients departments, outside the X-ray department as well. Wherever at Mount St. John's patients have to wait, and or their relatives have to wait to access the services, we think that we can help that experience to become significantly more optimal by deploying a free Wi-Fi signal. It is 4G LTE enabled as we speak. There's a team outside installing one there. So that is the first sort of assistance we're offering today. Obviously, there are both advantages and disadvantages to putting in Wi-Fi in these types of areas, but in my submission, the advantages far outweigh the disadvantages. Approximately 32% of Antiguans, if not 35%, access the internet and read mail and communicate with loved ones now via their smartphone or mobile device. And we believe that offering a Wi-Fi signal that is unrestricted, meaning that it does not require a password, in these areas in the hospital can help to make the patient MSJMC experience better. The other area, of course, is the need for hardware. So, of course, this is a huge institution, and I believe you probably have a staff complement of at least 500 or 600 people here. And if we are going to all agree that we want to deliver as optimal an experience as possible, access to technology, and specifically the hardware, is an important prerequisite. So today we're handing over, I think, 13 units to Mount St. John's. We recently got some hardware, and Mount St. John's has been prioritized for the hardware. And Salma did indicate we've been here a few times before. I believe this is either the fourth or fifth time we've been here assisting. We had deployed 10 of the 4G LTE devices here for the members of the various departments. I do want to announce today as well that should it be necessary, Mr. Desha, we will also allocate 10 more of the 4G LTE devices for various parts of the hospital as you see fit, so that what we're doing is essentially providing you with a conduit to get onto the internet. I am aware you have a local area network. Sometimes you may need to, get a signal in a certain room for a demonstration or whatever. So we have 13 PCs, and we're committing to providing, should it be necessary, 10 customer premises equipment. I also want to say that we have begun deploying hardware in a phased way in all the medical clinics in Antigua. We've had a request from the Ministry of Health, and a survey is underway systematically, clinic by clinic, location by location, to actually put in, at a minimum, one desktop PC, a printer, which could be potentially a printer scanner, copier, fax, and of course 4G LTE connectivity. And as I understand it, there is a move to get all the clinics connected to your radiology software here, and Mr. Desha can speak to that in a moment. What that would mean for the patient in the rural district setting is that they will be able to sit with the physician and if their blood results, which were processed at Mount St. John's or potentially at a private laboratory, they can be sent to the physician if they're already not there. Secondly, it will also enable some of the radiology reports to come in real time. I do want to caution, however, that Mount St. John's, obviously, and the medical clinics will have to establish some mechanism for archiving this type of data, so that this type of data can get so voluminous at one time you may end up spending half of your time trying to search for the results as opposed to having it in real time. I expect that by the first week of March, at least 4, if not 6 of the district medical clinics will be able to be up and running. We are trying to deal with the outlying clinics first, but within short time, and certainly before maybe the end of March, we would have had all of the district medical clinics hooked up. And I am hoping that this type of connectivity would lead to a far better, as I said, patient-physician, patient-healthcare institution experience. So thank you for agreeing for us to put up the Wi-Fi hotspots at the hospital, Mr. Desha. Maybe a couple months down the road, we can look to see some feedback as to whether there are some other areas of collaboration. But please convey my best wishes to the entire team that works here. My understanding is that the PCs are going in the first instance mainly this time to the outpatients department, and I believe your pharmacy department as well. So every one of us at some stage in our life, whether we have ordained it or not, will need to access medical services, and sometimes it's in a setting where the services need to be provided in a really professional and in a hurried but controlled setting. And I salute all the people that work here at Mount St. John's. So thank you, and happy Valentine's Day to everybody once again, and God bless you. Thank you very much.
Thank you, Salma. Good morning, ladies and gentlemen. Happy Valentine's Day. To the Honorable Dr. Minister Mansour, we thank you on behalf of the Board of Directors at Mount St. John's, the management team, the physicians and the staff, and soon to be the patients. What you said earlier about us being able to connect to the patients, being able to deliver on our promise in a fast yet controlled manner is exactly what we're trying to do. We want to bring the hospital further along in its capacity to build on information technology. As medicine evolves, as our treatments evolve, As patients evolve, we want to be able to evolve and keep up with the pace. In fact, part of our mission states that we will deliver quality health care using the latest technology, the most advanced technology available to us. So what you've done not only helps the patient, it helps us keep our mission and deliver on that mission. As you spoke about our commitment to the community centers, I've been in attendance to the openings or the extended hours for the community centers, and we are committed to being able to share our information with them, whether it be with the radiology or the lab, using our PAC system. We will use the information technology available to us to assist. The biggest goal was to minimize the impact on the emergency room here at the hospital. So in keeping with the extended clinic hours, we have already seen a decrease in the number of patients who are coming here. So the fact that the government thought this to be a priority, it is paying dividends so far. So we expect to see it grow, that more people utilize the services of the community clinics in the future, and it will open up the space for our emergency room to deal with the true emergencies that we were designed to take on. When you came the last time, you gave us your word and commitment that you would be back. And we appreciate the fact that you honored your word and honored your commitment. We will be writing to you again soon about that increase in bandwidth. We will need it. With a lot of projects coming on board, we will need the bandwidth. You may have seen some talk recently about a new digital mammography unit. There's some other things that will bring us into newer technology, and we will require additional bandwidth and additional storage space to be able to accomplish that. So again, on behalf of everyone here at the hospital, we thank you for your gift. We will utilize it to the best of our abilities, and we look forward to talking with you in the future. Thank you.